Hello, I'm Dr.Aniketh Venkataram. So, migraine surgery is a new treatment for migraines. And to understand how the surgery works, we need to first talk a little bit about what causes migraines. Now, migraine is an imbalance that happens inside your brain. Traditionally, this was what was thought. But recently, it has been found that there are what are known as trigger points in the face. And this is what is important for migraine surgery. So, trigger points are special nerves in the face that get irritated. And when they get irritated, they trigger the migraine. The most common trigger points are the supraorbital, which is above your eyebrows, the temporal, which is on the sides on your temples, the rhinogenic, which is inside your nose, and the occipital, which is in the back of the head. So a lot of patients have these trigger points. I myself suffer from migraine, so that's how I got interested in this. Now, in a trigger point, before the migraine starts, you start feeling something in that area. That's where the migraine starts. Have an aura that a migraine is going to come. So it starts in that trigger point and then it moves over to the rest of the head. Now, if someone has a trigger point, they are a good candidate for migraine surgery. So what exactly is a trigger point? It is a nerve that does not have a myelin sheath. So it's an irritable nerve. And this nerve gets irritated by many things. It can be a blood vessel near the nerve that pulses and irritates the nerve. It can be a muscle that is constricting the nerve and tightens it. It can be a band of fibrous tissue that is present around a bone, so the nerve gets squeezed over there. So when any of these things happen, for example, if you go out in the sun, the blood vessels open up and they pulse and that triggers the nerve. So when the nerve gets triggered, that leads to the migraine. Now, not everyone has a trigger point. So it's important to see if the person has a trigger point or not. But if you do have a trigger point, then you can be a good candidate for migraine surgery.